they could probably make $18-20 an hour to get their average up, which back then, you think about it, you get $100 to get their average up. You didn't have nothing to do, the machine was so bad, so you had to pay them average the rest of the day.
All right. I don't know what's popped up on there, but it won't show up on the other end. All right. I apologize for rushing in last minute, but whew, it's been a day. All right. Unofficially, well, let's call the meeting to order. Can I get a motion to approve the minutes from the last meeting? Thank you, Randall. And a second by Glenn. Any discussion? Hearing none, all in favor?
Aye.
Any opposed? Motion passes. Old business. I was hoping by setting this meeting at 5 that Dr. Carter should be here. This scholarship fund is, I don't know anything about it, other than I know there is a scholarship fund and there's roughly $80,000 to $85,000, $86,000 in it. I know the paperwork has not been kept up as far as the tax exempt stuff. I don't know what to do with that. I don't know how it's tied to the hospital or how to untie it from the hospital. I think it needs to be untied from the hospital, and it needs to have its own, that trust fund needs to have its own board that determines what, in my opinion.
Yeah.
I mean, if that board wants a member of the hospital team, then, that makes sense. And maybe even members of county government, a commissioner or two, maybe the guidance counselor from I don't know, but that is a major thing we've got to get figured out. And I guess I'm going to have to get with Dr. Carter and we may have to have a 7 a.m. meeting or a 9 p.m. meeting. I don't know.
Sure. I do know, Carter and I talked to it that a few months ago, I was over there. And in fact, he pulled some of the records out and not balanced the books or anything. And I remember at one of the meetings, this goes back, Landon Brake, who you probably remember him, probably nobody else does, Sonny. Yeah. He worked with, I forget what it was him, but it's Ameriprise now. And I called him, and he's the one that said they had 80,000+ in there and had some more they could probably put in if somebody would talk to him. And I could pass that information on to Carter. And evidently he didn't do anything. But I don't know.
Yeah, that's under old business, and it's getting pretty old, and we need to get it. I don't know what the answer is, and Dr. Carter's holding all the cards on that. He's got all of the information. He's got the checkbooks. He's got all the records. He's got everything. And honestly, it's not fair to him for him to have all of that. That's a lot of responsibility and liability on him if something were to happen to that money. Not saying that I don't trust Dr. Carter, but
I know Robin Black's daughter got a scholarship, and that may have been the last one they passed out. Because I was on that board at that time.
Oh, and I forgot to call Stephanie. I told her I would call her at the beginning of the meeting. I always forget.
Do we know who is currently on that board or is supposed to be on that board for that?
There hasn't been anybody on it for a long. See, the hospital, I don't think the money's tied to the hospital per se, but the hospital sort of administered it.
Right.
When Rita Brady was here, she kind of handled it, and Dr. Martin was on it in 2 or 3 years, and at that time I was
Hey, Stephanie.
chairman of this board. So I was on it.
Sorry, I'm a couple minutes late getting you
Make the donation to start.
called in here. We're discussing I don't even know if you're aware of this, but there is years ago there was a scholarship set up for Houston County residents to pursue a career in the medical field. to help them pay for school or books or whatever. It's got a pretty sizable amount of money in it. And it hasn't been kept up with as far as the financials for the trust, the tax exempt status and all that. And Dr. Carter has all of that information, and he's not currently here at this meeting, but this is, in my opinion, this is one of the major hurdles. We gotta untangle this trust fund from the hospital. If it's tangled up with the hospital, I don't know. It may just be that it was set up to where the hospital administrator and some of the members of the board were members of the board of trustees over the scholarship fund. So we need some financial and legal advice as to how to untangle all of that and have it be a standalone trust fund.
You want me to get with Carter?
If you could. Yeah,
Because you got a lot of money now.
I got
don't mind. I'll
a
get-
million things going on right now.
I'll get with him. 'Cause
Okay.
he was gonna talk with Martha while she was still the mayor and see what he needed to do. I don't know if he did or not.
Yeah, and now we're kind of between legal representation.
But from my understanding, I don't believe any current employee of the hospital has sign-in abilities on that account.
Nope.
And that money is not in any hospital account.
I don't think it's time to the hospital.
I think you're right where there were members of the hospital that were on the board, and it was,
Yeah, because it was tied to, this was your sole place.
this was the healthcare center of the town, and that was a
So-
healthcare related.
And I can't remember the
Situation.
names of the people that donated. If you needed, I can.
Right. At one time, it was a prominent family that lived here in the area.
They were from Cummins City and they wanted to do something for local.
Right. Yeah.
The Shannon family.
Oh yeah, the Shannon
Yeah,
family.
that's it. You're right.
Yeah,
Awesome.
Shannon.
Good memory.
Yeah, good job.
I got the scholarship.
Oh, yeah.
I did.
Well,
When did you get? your-
2009.
They may have had one that.
But Robin's daughter would have been after me, so
Okay,
if she
they-
did get
yeah,
it, then
so
she would
that
have been
may have
after
the
me.
last one.
yeah, we just need to. Somebody needs to do some digging in that and figure out what needs to take
That's
place
okay, I
to.
just get with you.
Yeah. And at one time there is an account at Traditions that is a hospital account because Doug Martin was a signer. That's how I come to learn about this trust fund. Doug Martin was a signer on that account, and it's got like at the time it had like $800 in it, and I was told that we needed to. The bank actually contacted me and said, "Hey, we've got this account where Doug Martin's still a signer. We need to take him off or change it." And I was like, "Well, what is this account? Never heard of it." And it was some kind of a operating account off of this trust fund. The trust fund, I guess they would transfer money from the trust to Traditions, and that's where the checks would go to the recipients of the scholarship or something. I don't know, but I think when Doug Martin becomes CEO, they just made him the signer on everything hospital related, and it got put on the trust account.
And there may be some
So-
other money floating around.
Right.
I'm not sure.
Yeah.
Because I think there was some reluctancy to put it all in the investment firm. So
Yeah,
there may be
they're
some more, I don't know.
and that's why we need Dr. Carter, and we probably need to find an accountant and a lawyer that deals with trust funds.
It's okay. I think get him to set up a meeting.
And
Three of us and then I'll
yeah,
get back
and
to you.
when you go to that meeting, I don't even know if it's legal, but maybe they can use some of the funds in the trust to hire an accountant and an attorney to
Probably
handle
gonna have to do
the
something.
trust, because at this point, I mean, who's going to pay for for the accounting of it and the new documents to reestablish the trust or whatever needs to be done? I think the trust's got a little bit of money. They need to pay for it themselves out of
I
that.
don't think it should be. I'll agree with that. Shouldn't be the hospital or the county.
Right. Yeah. Okay. Any other discussion on the scholarship fund?
In the hospital, like in my eyes, I see that's completely separate from the hospital completely.
Okay. Well, I
There's
just
no
want to.
intention of bringing that back into the hospital. That needs to continue to do its mission of getting people those scholarships, and whatever we have to do to make that happen.
Right.
I'm happy
But
to help.
it doesn't need to be tied to the hospital, other than if somebody from the hospital wants to serve on the board of trustees just as a medical professional or whatever. That's entirely up to y'all. Y'all might not even want to mess with it.
I think the scholarships were decent, weren't they?
Mhm. They were either
Couple-
500 or 1,000.
Yeah, and I think it got up to $2,000 or $3,000. So, I mean, that
Okay.
needs to help.
Well, that's just something I wanted to bring up, make sure we don't forget about, and that we need to get that handled.
But from all I've seen with all the audits of accounts and everything, that does not currently fall under hospital. Maybe Doug may have been a signer, but my understanding
Right,
is
I think
not
it
a
was
hospital
just, I think
account.
that was him getting put on that account was just a fluke at the
Right.
bank, just because.
Is the grant what holding us up to getting it transferred?
Oh, no. No, it's just one of those loose ends that's out there that I don't want to lose sight of. I want to make sure that trust fund is protected and it continues to do its mission that it was set up to do.
There could be a scenario where the signer, or maybe in the bylaws, or just the documentation where it said hospital CEO to be on the board or something like that. If they put a positional statement like that, the hospital's involved in that situation. But I mean, we're happy to do what we have to get it set up back to its mission and out of this transaction.
Yeah. Okay. New business. You guys have got some credentialing paperwork you need done?
Yeah. Renewals.
New rules?
No, renewals.
Oh, renewals. I think you said new rules.
No, renewals.
I'm hearing dyslexic. And all of these are renewals?
Dr. Court might have been new if we didn't have him last time.
Yeah. Anybody like to look at the credentials?
But they were approved by staff.
Okay. All right. Does anybody want to make a motion to approve the credentials for renewing the credentials for the medical staff?
So moved.
Second.
I keep wanting to take notes, and Kayla's over here taking excellent notes.
I
Okay.
gotcha.
We have a motion and a second to accept the credentials for renewals for the medical staff. Any discussion? All in favor? Any opposed? Hearing none, motion passes. Thank you. All right. These are some items that I put under new business. And I'm hoping we hear something either from the AG, Jay Reedy's office, or somebody. Where we're at now is we're waiting on trying to get clarification on, was the 45 days actual days? Is it 45 business days? Does it include or not include holidays? Trying to get us a drop dead date of the AG's time has lapsed and we are absolutely okay to move forward.
Right.
I've reached out to the AG. The Braden team has reached out to the AG. And we've got no response, just like always. We never get any kind of response from the AG. I mean, I wish they would just call me and scream ugly words to me or something. I mean, but one way or another, this deal is going to go through. So we need to come up with a plan for the accounts payable. And we need to get a list of all of the accounts payable and figure out how to pay those down or pay them completely off. There's a couple of the accounts that are in dispute. I don't think the county or the hospital, either one, has any appetite to pay anything to the lab folks. I don't even want to mention them by name. With the self-reporting that we were required to do because of what they did and the lack of documentation to try to bill any of that, I just don't see any reason why we should pay that, even a very reduced rate. But we need to figure out how to get that cleaned off of our AP. I don't know what the official process is to remove disputed accounts from your accounts payable. There's got to be some way.
If I'm mistaken, I think the last time we seen a list, there wasn't a whole lot. on there. It's been
there's
paid down.
it had been paid down
tremendously.
so much, and if those two lab accounts weren't on there, it's I think what $25,000-$30,000, which is
It's
just the
something very
average.
Small, yeah.
Yeah, it's just their average operating.
I think
We
the
just
grand
need to
total
figure
was
out
140 or so, including the lab accounts,
right.
something like that.
And
Have we had any correspondence from him at all?
the last interaction we had with them, the CEO of Expertus showed up here to pick up a piece of lab equipment that was here. Dr. Braden called me and said, "Hey, this guy's here to get this piece of equipment." I told him let him have it, and they discussed a settlement between the two of them. But he wanted, he thought he was going to come to the courthouse and I was going to write him a check. And I made it real clear that it doesn't work that way. If there was any kind of a settlement, it would have to go first through the hospital board and then have to go to the county legislative body to be approved by them. And I don't think it's going to pass the hospital board, much less the legislative body.
So something we're gonna put the new county attorney on.
Yeah. And then,
When did they start?
and so after that discussion, I got another email. I got a demand letter and an email for payment of the full amount. But like I said, they can't provide, good documentation that the orders were good or that, anything. It was
Do you have a CPA that does any of the bookkeeping part of it? Might be able to write it off as like a bad debt.
Couldn't write up like that.
well, yeah, we can't write it off like that because it's not a bad debt to us. It's a bad debt to them. They could do
They
that.
could write it up. What if we get our new attorney just to send a letter?
Yeah,
to
I
the
think
effect,
right.
we've not been able to get proper documentation, and you guys can help word it however you feel necessary. And we have no intentions of paying it under these circumstances.
Right.
And I'll make that into a motion.
Also,
All right.
We
I
just need
will.
to get rid of it.
Yeah. One way or another, it needs to.
Yeah.
It needs to be removed from the accounts payable so that we're. Because the way the state of Tennessee is, I mean, you don't just not pay your bills. I mean, if you got a bill, you pay it, or you show cause for why you shouldn't pay it. So,
right.
I will discuss that with.
As plain as he can.
I will discuss that with Charles as soon as I can.
I mean, when Markley tried, she just never got responses back, and that's where she ran into trouble.
Right. Okay. Moving on, the next thing is going to be paying out when this transition happens. Houston County or the hospital is on the hook for paying the employees' benefits and paid time off, vacation, anything, anytime, any PTO that they have that has not been used, they need to be paid for before they transition over to Braden Health and pick up their new time or whatever. So we need to try to, and a lot of this is contingent on what we hear from the AG and when our drop dead date is and when this transition can happen, because we need that date so we can calculate the AP and the employee benefits. But I just want everybody to be thinking about this stuff as we seek that date out. And then last but not least, I was contacted by Bill the other day about the Houston County Community Hospital records, that because this hospital's been operating for going on a decade. There's a lot of records here, medical records, financial records, all kinds of records that Braden Health is and Shamrock are not going to need, they're not going to want. But as a hospital run by a government entity, we're bound by our records management laws and rules to keep those and maintain those for a certain time. That's why I asked Miss Melissa
down here.
to be here as our county archivist and records manager. I don't know. Are there some of these records that we could start working on now to go through them?
Absolutely.
Okay. And I was told, I believe it's my understanding that Jennifer Warren has been moved into the main hospital building.
The shed for supplies back there used to, store all the medical supplies. That was not conducive to smooth operations in cold and inclement weather. So we
Right.
put all the supplies back into the hospital.
Are you talking about the it's kind of a big building with the
Mhm.
garage door?
Correct.
Is it air conditioned?
One very small section is.
That's all we need is a very small section to be, so that records can be brought in, they can be sorted in an air conditioned environment and disposed of.
Well, there's more to it than that.
Well,
There's a process.
I know there's a process.
Yeah, what we have to do is we'll have to, and as you all know, there's not a whole lot of counties that have their own hospital. So I use a manual from CTAS that is records retentions. And so I may have to reach out to them to find out records retention on like patient records. Financial records countywide are 5 years. Let's keep them for 5 years. So if we have financial records from say this year or last year or the year before, we're going to have to keep those until their retention is met.
Yeah.
Any records we destroy, whether it's now or it's in 5 years, there has to be an inventory done of what the records are, what timeframes that they cover, what CTAS, what TCA codes tell us that we can destroy, and then that inventory has to go before the Records Commission. And then they have to approve the destruction. We can't just destroy them. We have to get permission and they have to be documented.
Yeah, I simplified that process a lot.
And then the person who does the work is, but and so it's a process. I'm going through that process now with a bunch of old records that are in the basement of the jail because, as you all know, the UT Extension Office got a grant and they're going to be refurbishing that building, but there's records in the basement and we have to get those out so they can do what they need to do. It's a process that takes time. Records Commission only usually meets twice a year, but if it's something we need to get done quickly, we can meet more. But no, we cannot destroy any records unless it's documented and approved. Because then when someone comes back to me and says, what happened to these records, I can pull it out and say it was approved. Otherwise, so we have to go through the records and we have to inventory what is there.
So,
I say we, but I mean, I guess.
when she says we, she's talking about her and the mouse in her pocket.
Yes. Yeah.
So my question to the hospital is, could that area be used to temporarily store these documents until they could be sorted, inventoried, cataloged, whatever needs to be done? And Melissa is she's very efficient. She can go through stuff very quickly. She's been doing this a long time.
I'm going to have to get a direction from CTAS and maybe someone here knows in the medical profession about patient records. I don't know how long we have to keep patient records. Once we get that guidance, it'll be very easy. Matt showed me some rooms in here. I can tell you that those records are on shelves. They're not in boxes, a lot of them. So they're going to have to be boxed. Yeah, they're going to be boxed. And which is, that's a cost, first of all. And second of all, it means it's going to take up more room, make up room. But it's a process. We can get it done. It may not, it might take us a little bit, but we can get it done.
A couple of weeks.
No.
To box them up, yes.
Yeah, really. Yeah, he just showed me what was in these little rooms here. And so, yeah.
Yeah. I mean, on our side, we're happy to accommodate, having you guys use that space out there. There's becoming less and less use for that space as we get everything out of there. We're just wanting to clear those rooms so that we can juggle some of the office space to get additional clinical use of the hospital. Because that whole wing on that side has offices where those could be patient rooms. So.
Patient records that are in there on the shelves, are they alphabetical? Is that how they're arranged? How are they?
Medical record
No record number. Because, like I said, until I get guidance from the government agency that tells me, like financial records,
Kayla manages our medical records,
by date, and then so I can look at the date of those records and I can say, okay, well, our 5 years is over, we can destroy those. Medical records, like I said, I gotta get some guidance on how long we have to keep those.
As far as I know, it's 10 years
Is it 10
regulated by the
years?
state.
Okay.
And all of our records are not scanned in either. Because we didn't start CPSI until 2014.
Mhm.
So I would say like from 15 on is scanned in, but anything before 2015 that's on the shelves and in the folders, it's not scanned in.
So you're saying that the retention schedule is 10 years, but not only that, but they have to be digitized before they can be destroyed, or no?
Well, otherwise we wouldn't have. If you could not destroy the ones that had before the 10 years. So I mean, we have to keep from 2012 till current. So
Okay.
2012 to 2015 is all paper and not electronic as of right now. So you would have to keep all of those.
If there's
Unless
some-
we could-
2015 to current, the scan in, you could show because they're digitized.
Correct.
You wouldn't have to
Okay.
run.
So we do
But
have
you're
records
saying
of
from
those.
12 to 15, the ones that are not digitized have to be digitized first before they can be destroyed.
Correct.
I wonder, do you all do that here? Or I'm trying to think how that process.
Well,
goes.
I'm medical records, and I'm
Okay.
the only person that does it. We have one scanner that
Yeah.
scans that
Or
stuff.
do we
But
hang
she
on to
has
those?
really no throughput to scan all day.
No.
I'm sure.
She's very busy with just her regular duties.
Sure. Okay, well, that's something we'll just need to see how we're gonna do this. But let me see, you said 10 years, did your medical records? No,
Yeah.
10 years.
And that's
so-
like I said, that's a state of Tennessee.
And it may be easier just to retain them than to destroy them and digitize them. Just retain them for the 10 years, then destroy them, and you ain't gonna worry about it.
Right.
Okay, so you just have to retain them for 10 years,
Uh-huh.
whether they're digitized or not. Right?
That's what I'm trying to get verification on.
Yeah, well, I mean, we would need. I would obviously like to verify all that, but
Yeah.
Because if they're digitized, I mean, you could virtually keep them forever.
Well,
Mhm.
yeah.
I guess
Except
then
that
we have to
we
get
have
get your
digitized records that we have
access.
to keep forever because they're considered permanent record, county records.
So we
Okay.
would then get you access to the EMR that in that situation, the electronic medical record.
Yes, and we would, yeah, and then you run into, they're not gonna want to store it here electronically. You're gonna want to transfer, I'm
It's
guessing.
cloud.
It's
We don't have
cloud,
the physical
yeah.
server here.
Not that we would need that access for anything, except for the fact that if somebody were to need a record for something.
Yeah, and
The
that,
next hiccup.
that in lies the problem.
Well,
Yeah.
We are already exploring our own build of the EMR for ourselves post transition.
Mhm.
So in that case, would the county want to? Well, if you want to keep access to those electronic medical records, you'd have to pay the maintenance fees for that access.
Mhm.
I haven't seen the updated maintenance costs of electronic access for a read-only status. It is much discounted to what we currently pay for a live environment. But I mean, it'll probably be a couple $1,000s a month.
Yeah, it's expensive.
So, alternatively, they'll probably be happy to give you a hard drive copy, but you know, once you get a request, good luck.
Well,
Um,
and what would, and the other thing too is you have to think in the future, technology changes, and so we may have a different, like you go from floppy disk to CD, from CD to hard drive, and so you have to think ahead about transferring. I can't imagine it something else, but there probably will be.
Medicine still uses the fax machine. They're going to stay with this similar digital format for a while. I can promise you.
Okay, good.
Okay, well, this
That's the
brings
least
up,
of my worries. The paper records are actually the part that's the biggest.
this brings up a question. We get the drop dead date from the AG or whoever we end up getting it from. One day we're Houston County Community Hospital. The next day it's Shamrock. If someone calls the next day and it's Shamrock Community Hospital and they want records from Houston County Community Hospital, does Shamrock automatically send them to us? You guys,
I would
do you not have
I don't
access
know
to
what
those
your
records?
thoughts are, but I would say technically, and we'd have to get it confirmed that those records are the county records, and they would have to go through a public records access request, which that's what I handle.
'Cause
And then I can
the
contact
problem I'm
them.
seeing is somebody comes to the emergency room on the weekend. This transition happens on Wednesday
Mhm.
and Friday.
Yeah. it can
They go
happen.
to see a specialist and they need their records from last weekend. And they contact Shamrock Community
Mhm.
Hospital and says, I need my records from the emergency room for last weekend.
That could very well happen.
What happened when they did it in Lexington? Do you know? Did records just go away, or did you have to maintain them for a period?
I
Recall?
purchased the software to maintain it at $250,000.
So from 15, they're all scanned in, so I mean, they ought to have.
And then we scanned them all. We scanned all the paper records, and we purchased access to the digital records.
But are you talking about like you purchased access to like CPSI where our digital
Right.
records
We had
are?
our correct.
Because right now Houston County Community Hospital has CPSI, but Braden Health doesn't.
We do have our own.
But
Sounds like this is a job for you, New York. You're lawyer to see the liability. of
Can
that
your-
needs to go.
Can your user for CPSI look at Houston County Community Hospital access post transition?
If we transition the records, yes. But I'm imagining it would be least disruptive and least cost to the county if we overlap access with both entities
Right.
post transition.
Well, that's what I'm trying to figure out for, like, here's the drop dead date. If we could go 6 months back and 6 months. I mean, I don't know. I'm not a medical professional. I guess sometimes you do need medical records from 3 years ago.
Oh, yeah.
Dad had a heart attack.
Caleb.
What exactly happened in that event?
Kayla, for the most part, a lot of the records are still paper, right?
Yeah, like I said, 2012 to, like I said, we got CPSI in 2014, but I would say the rest of 2014 was kind of a transition period. So I just go ahead and say 2015 because some of 14 might be scanned, but some of 14 might not be scanned.
Mm.
So 2012, 2013, and 2014 should all be paper, give or take some.
Okay.
And then 2015 on should all be digital.
But do we still have the paper copies of those? I just don't-
Probably, they're probably outside.
See, that's what I'm wondering is if we have the redundant, because this place is not destroyed with paper, which is good and bad. Kayla, can we double check to make sure if we have still the original paper copies that exist all the way through? Because then the county may not even need complete digital access.
Yeah, I mean, I can see
That would be
what
it.
all I can see what all is outside.
Yeah, I mean, if somebody contacts the county 2 years from now and they want to see something from 2017, 2018, if it's paper, we could get it without having any kind of digital access. If they contact you guys,
Yeah.
you could do it electronically, maybe. I don't know.
Correct. And I'm happy to work that out where, if we have access to the system and we pay for the system, but it's still a county record, we can work with the county to.
What would bother me more would be James comes in here on a Monday and is treated for something real severe.
Mm.
He has relapse and change has happened. He comes back on Friday and you need to review those records and it's no longer Houston County.
Right.
How are you? You're up to.
We need to try to make it as smooth as possible
Yeah.
for
Well,
the patient.
Problem is going to be, how are you going to get the records? Because there's no county employees for him to contact on a Saturday to get the records.
Right.
So you're going to have no referral from that previous state. Something like that's going to have to be covered at least for maybe a month or two prior to the takeover, where you have readily access to those others. I can understand,
Right.
but the patient has to be protected for that period of time. I would think.
We'll maintain enough for the record. And I mean, post transition, I expect us to continue access to the record, be able to pay down or to keep collecting the accounts receivable and work those claims and get all that stuff handled. Unless the county wanted to purchase an instance of CPSI, which I would imagine they do not. You will have to basically
We're getting out of the
depend. You will depend on us to maintain that. So it'll be out of our convenience to maintain it, and then if we build our own, we can see what options exist there with cost and CPSI, and we can work it out something amicably at that time. Because we do want to get to our own custom build.
And I would think it would be to your benefit as much as it would be to the counties for that patient that's coming back to
Right.
you to be able to respond to their needs
Oh, of
immediately.
course.
That's it. Well, I really can't help you now, you're gonna have to go somewhere else.
For continuity of care,
Yeah.
I think it's more so these old
Yeah.
paper records. What do we want to do with that? For the digital records,
Especially with patients that have passed away or
All records I can understand.
digital records we can maintain for a while.
So there's patient records, other administrative records that
All-
would also be under the heading of going back to the county.
Everything that we currently have from any previous audits, anything on our that's the shared drive, the administrative drive, we still have all that, and then that would have to be passed on over to you. Fortunately, that is all on one hard drive.
Good. And then
Um,
how far back to the records go? I mean, when county bought the hospital, did any of those records before stay?
Yes.
You know?
I know some files go back as far as 2009 on that drive.
Okay.
There might have been some from 2000. I can't recall if it goes back as far as 2002, but I know I've definitely seen as far back as 2009.
What about paper records? Do we know how far back they go?
It just depends. There was a time when I was able to go and purge old records, but not lately, not in the
Okay.
past few years.
Okay, so you were able to purge records.
At some
Okay,
point,
good.
yes. Like when I
That's
very
good.
first started here, so 2016, I was able to purge in the very
Oh,
beginning.
good, good. Well,
Yeah.
that helps.
So yeah, there are records that have been purged, but lately none of that's happened.
Let's just be a process, and we'll just do the process and get through it.
Okay. Well, like I said, I'm hoping that we're close to the finish line of this transition. It should have happened a year ago.
Yeah.
At least 6 months ago. So I know that we're not getting any answers to any of this new business stuff. I just wanted to make sure everybody has this stuff in mind moving forward. Because we probably need to start trying to meet, if not weekly, at least every other week. Because I'm hoping that things are going to start moving faster. They've got to start moving faster. I mean, we may just have to do this thing and I don't know what the Attorney General can do. I mean, smack our hand I don't know what. But
I mean, at this point, I think what we're really waiting on is acknowledgement that the time has expired and that, we're in full compliance with the statutes. So our interpretation of 45 days was that July 6th or 7th, 8th, something like that. And then
we counted calendar days.
And then 45 business days, I think it was like July 26th or 27th. I think from my understanding with the recent discussions is that we would be, anxious to proceed without any acknowledgement whatsoever from the AG at all. Like if they complete radio silence, it would be very nice to get that clarity that they interpret it as we do.
How long is left on the current AGs?
The current Attorney General will be out of office in
September 1st. I believe.
Yep. I
It
mean,
would be nice if they would go ahead and get this off their agenda.
yeah, because a new Attorney General is going to come in and be like, why is this still here?
Well, I mean, per the statute, they don't even have that time technically. So.
No, check if they go by the law, they should.
Yeah, even worst case.
Already passed, so
Right.
something's wrong.
Worst case scenario, if we have to just count business days minus holidays and everything else, August 1st
I don't think
is as late as possible.
I don't think we're gonna get a reply.
I just don't understand. I really don't.
They should tell you something.
Kind of like
Backing up just a
Line
second,
deal.
I'm sorry.
Go ahead.
We was talking about writing that kind of letter. Should we give him a time frame of saying we need a response by within 3 weeks, 2 weeks? So
You talk about the lab
Well,
scheme
we don't
guys,
want to say
the lab guys. I think I probably need to get clarification from an attorney and maybe even an accountant as to how. I know there's got to be a process, because if I send you a bill for a plumbing job that I never did, I mean, how do you dispute that or take that off of your?
My thought was if we send them a letter and saying we expect the records we need to process bill by, we're backing up. we have wasted time waiting for your response. You've not done it. It's become long past due if we've not had a response within 4 weeks, 3 weeks, whatever. We're going to write this debt off. And I just, I tell them in the letter, and I thank the lawyer because I think
Okay. Yeah, because I believe, and again, I don't know, you guys probably know better than I, but I believe that if they provided us all the documentation we originally asked for, it's too late now to submit it to Medicare, Blue Cross Blue Shield, anybody.
Maybe that's what we can say.
And we just, I mean,
We wouldn't touch those claims with a 10-foot pole.
Yeah, no, I mean, we self-reported to those insurance companies that there was an issue with those. I mean, and they're not going to pay them regardless.
What to do there. Then how much money are we talking about on the benefits? You know,
It's like 50,000 right now. 50,000, 50.
okay.
So, and I would like, I mean, today, Houston County still owns the hospital. If the hospital can pay for those benefits, and so the county, you know, because it's not in our budget anywhere.
It would be very nice if it was possible.
Yeah.
I know it's a little different, but EMS has got it in the budget to absorb the EMS ones.
Well, yeah. Yeah.
We're going, how often are we going to meet?
Every 2 weeks.
Yeah, let's,
I would say.
Let's start off with 2 weeks and see how it runs.
All right, I'll make a motion.
let's see, let me look at a calendar.
That would be
Because, I mean, if we hear from the AG tomorrow, we're going to want to meet next week. So,
We send a Teams meeting out, we meet virtually. If we need
Okay.
to throw something
Yeah,
together.
let's,
session.
So you want to go weekly? Cancel it if you don't need it?
yeah, let's
That's
just,
not a bad idea.
what, yeah,
Probably
what,
easier to do special meetings.
what days works better for everybody? Is Wednesdays okay? Is 5 o'clock okay? And maybe if we let Dr. Carter know in advance, hey, we're going to be meeting weekly at 5 o'clock, maybe he can move his schedule around and actually.
It'd be nice if he was here.
Right.
When he and I talked, he wanted to come to it because he still would like to discuss a rental agreement on this facility.
Okay. Yeah, let's set it tentatively weekly Wednesday afternoons, 5 o'clock. And if we get to next Wednesday, or we get to next Tuesday and we haven't heard anything, we don't know anything, there's no reason to meet, we'll send out an email and just postpone that meeting until the next week. Is everybody okay with that?
I'm good with that.
Okay.
With saying that, then I'll make a motion that we request that the hospital look at the feasibility of paying those funds and then report next week. That gives you time to look and see if you can do it. If you can't, I mean, you can just tell us, but
No, just pay that 50,000 out of our operation.
Yeah.
We could afford that. I'm sure of it.
all right. And I'll make that motion so we're covered.
Second.
All right, so we have a motion and a second. All in favor?
Aye.
Any opposed? All right, hearing none, motion passes. So I'm just gonna put on here that Kayla has got the.
Be sure to write that one down.
Yeah.
Okay, next up is the mayor's report. I have spoken enough. I don't know anything else. I'm sure there's something that I've missed. But with us scheduling these meetings weekly, we'll have time to discuss those later. So moving on to Joseph, you got anything for the CEO report?
Not a whole lot. I mean, operations have been solid. Had good patients coming through. We got Alan Famfro here, our new CNO. He's been a strong ER background, and really excited to have him to really push us to the next level for nursing and patient satisfaction. So he brings a lot to the team locally.
I'm not sure how to do it, but you need to put it out that he's here and where he came from. Because as I'm campaigning and everything else, there's unfortunately Houston County Community Hospital still has a reputation of you don't get good service, it's slow, it's whatever. You know, and it doesn't come from the 65 and up demographic. It's from the 50 and under who, you know, cut their finger real bad and was here 4 years ago and experienced a bad experience and have no idea that things have changed. I don't know how to put it out there that, you know, it's drastically different than it was even 2 years ago, year and a half ago. I mean, it's, and I've told people at several of the mayoral forums and different things that I've gone to that not only would I come here, but I would bring my wife here, my grandmother, my granddaughter. I would put any of my loved ones' lives in the hands of this hospital any day. I mean, anytime. It's just as good as any other hospital within an hour's drive. And
It is.
And if it's an emergency, you better stop here because you're liable to not make it to the next hospital.
And to me, that's what we want. That's what we're trying to build, and that's what we're trying to bring.
Right.
Is that, you know, we know the limitations of the hospital.
Sure.
We don't have a ton of, you know, we don't have specialists, stuff like
No.
that. But from an emergency room standpoint, we are here to make sure we stabilize, treat, and transfer as necessary. But you're going to find, I think, a lot of times that it's going to be well within our capability to take care of the patients here. You know, you talk about rolling it out. I think that is our plan to roll out as we make the transition.
Okay.
And like I said, I know as we rebuild and stuff like that. So
Yeah,
I'm
it's just-
excited.
I mean,
I am very excited to be here because I see a lot.
in Houston County, and I'm assuming in most small communities, once people get it in their mind that things are a certain way, it takes a long time to change that culture, change that, and so.
I totally understand.
Actions will speak louder than words. So we just need to get people in the door, show them what we're able to do.
Right.
It's good PR can really help. Something so simple as you as the administrator, someone's in there, you stick your head up in the morning, because I remember back days gone by that carried so much.
Just walk the halls, just say, hey, I'm the CEO. How's your stay? You know,
anything I can do for you. Yeah.
Yeah. I mean,
Beck Osbush when he was here, that was his first thing he did in the morning, visited every patient, just to say, how you doing?
Not trying to tell y'all how to run.
No. Actually, what you're saying,
that's the things that have worked in the past, and that's what people say. We miss that.
You may not live down the street, but if they can relate to you, that, hey, he did this for me, then you become family to him.
Yeah, and that's actually, we've already discussed these type of things. I said, like for myself, you know, I'm available enough that I'm around on every patient that comes to this hospital just about, and that includes the ED when I'm here. So, because we're small enough that I can pretty much do that. And so it's about getting to know them, getting to know that we're here and the changes coming.
It's just nice when they say, well, you know, James came by and saw me while I was up there.
Yeah, it's very
They
very
know
true
your name.
words.
Yeah.
Very
Right.
true words.
Always happy to reach out to these patients, see them.
Yeah, I mean, I've used this hospital for my family, and I've also used Dixon. And Dixon, Horizon and Dixon is phenomenal. I mean, you go in there and if you need to be seen, you know, they don't even triage you before you go back. They take you to a room, and they'll triage you there in the room while the registration person's got a computer cart there getting you registered. I mean, they're doing three things at
We
one time.
implemented that about 8 years ago. I actually moved into the manager position, and my director at that time and I put together direct vetting and implemented that process 8 years ago. It was the number one thing that changed the perception of the community. And because getting them back, because we don't have any delay time getting them back, and we've already discussed process
to get
changes.
that in place
So,
here.
yeah.
That's one of the things that, I mean, when I think of Horizon, if I feel like my wife or one of my loved ones needs to be seen right now, I mean, the only time we've really gone to Dixon was when things were sketchy here, or when my wife has had episodes, or one time she slipped and fell on ice and dislocated her knee
Sure.
in front of the pet store in Dixon. I wasn't going to bring her back here.
Sure.
So, but a tremendous service at Horizon.
That aspect of service and that patient experience,
Right.
he was, fundamental in implementing.
Yeah, when I heard
so.
you
Come
cover
from
when
Dixon.
I did. I was the manager at Dixon for 2 years, and then I took over as a director for about 4.5 years in the emergency department there. And so, like I said, I've got 26 years of ER experience, 30 years almost of nursing experience. Have served multiple roles as well, like chest pain coordinator, pediatric coordinator for the facility. Have presented to the whole company of ACA about our processes and our flow processes and things, what we were doing to improve patient satisfaction, and what we did on the front end and back end process to improve our patient times and experience and stuff like that. So there's a lot of things that I have a lot of experience with. I told them what I'm really, really good at is process and flow and stuff like that. But I'm having to understand now, this is my second week into the job here, so I am new to this community, is making sure that I understand what I'm working with, where we are right now, so I can see where we need to improve and build and things like that. I'm very excited to be here because I see a lot of opportunity and excited about the work that I think I can bring to it. Braden I'm excited to work with them because I know they're going to fix it. They're invested into the hospital. And so when we do a rebuild of the ER, rebuild of stuff, I actually think that's the time we really roll ourselves out.
right.
When we rebrand and re-roll out, that's when you get out in the community and make sure you meet. Because I want to make sure we're ready, because they're going to try us again. And when they do, I want to make sure we're ready to meet exactly that expectation that they want when they try us. Because honestly, we're going to be putting the best care we can. This is your families, this is your friends that we're taking care of. That's what's important to me, is make sure we're providing the best care we can to those people. So.
And I can say personally that he's a top-notch guy.
Thank you.
I've known
Yeah.
him my whole life.
Yeah.
Oh.
His mother and my mother were best
They work
friends.
together, and
They worked together in surgery and
They
it's
sure
for
do.
30 years.
That's all the endorsement I need.
Unexpected twist.
actually, our brother and I went to nursing school together.
My brother's a vice president of home health care in Lebanon.
Oh, Mr. and Mrs. Lemaster were great people. And
Yes,
so
they
if your mother was friends with her mother,
Yes, they were best
Yeah.
friends.
They were. They actually.
they were in good company.
They were tight for a while.
They worked together. Yep.
That's awesome.
We're very
So you're
happy
not
to
you're not as much of an outsider as you thought you were.
I also say, and I also have some. My very first job was at Waverly, so it's a small town hospital. I already understand the challenges that you have in small towns, right? And from resources to things. Now I'm coming from a bigger system, but what I really am bringing with that bigger system is the fact that they are industry leaders in a lot of ways for different things, and they really do understand flow and process and things like that very, very well, and are always working to make sure we are able to provide the care that we need. So, I mean, it's great. Honestly, it was a great hospital to work for. It's a great system to work for. But I love the challenge that this is bringing to me, because rural communities are underserved, and I'm so excited to be here about that.
Yeah. You sound like the perfect guy that we need, because you have experience in both worlds, and you can bring the best of the bigger system to a smaller.
Adopt it to what we can.
Right.
And that's what I love.
And you understand that your role as a CNO at Houston County Community Hospital or at Shamrock is not the same as it is at Horizon.
No, I'm a bigger picture guy right on this,
Yeah.
But I'm also not afraid to get my hands dirty either.
Right. Well, the problem we've had with nurse administrators in the past was in a small hospital like ours.
Yeah.
And it's the same way in the mayor's office. I can't just be the mayor and make phone calls to say, make it happen, do this, do that. A lot of times I have to get out there